Happy Safe Motherhood Day. National Safe Motherhood Day is observed annually on April 11 every year, emphasizing the importance of antenatal care in pregnancy as well as skilled care during childbirth and the first few weeks after birth. The ultimate goal of the day is to provide better medical care in order to reduce the maternal mortality rate or its ratio, which can be defined as deaths caused by pregnancy or childbirth complications. The White Ribbon Alliance, that is WRA, a non-governmental organization founded in 1999, proposed the day as a way to educate all women and girls about the right to quality health. Because of lack of medical services and knowledge, the majority of maternal fatalities occurred in remote areas or undeveloped regions of the country, creating a huge gap in ensuring proper and skilled medical care during delivery or childbirth. The National Safe Motherhood Day plays an important role in educating people about the importance of proper medical care during pregnancy, delivery, and the first few weeks after birth. Let's learn more about National Safe Motherhood Day.
Safe Motherhood. This is the birthday of Kasturba Gandhi, which is celebrated on 11th April. It is celebrated as Safe Motherhood Day. Any woman feels complete if she becomes a mother. Motherhood, that is, if she is healthy, a healthy child is born, in turn a healthy society and healthy India. To bring out this, what are the important points the lady or the girl should know? The girl should be more than
21 years
and at least 50 kgs of weight, and hemoglobin should be at least 10 grams. She should be healthy from her childhood so that to give a healthy child, for which family support is very important. Once pregnancy is confirmed, the girl or the lady should take the following steps. Once she misses her period, she has to visit the gynecologist on a regular basis. She'll have to undergo the antenatal checkups once a month up to 7 months, and once in a fortnight or 15 days in the 8th month, and once a week in the 9th month. And if there are any high risk conditions, she has to visit even more frequently as suggested by her gynecologist. There she will be checked for the general condition of the patient or the woman, her weight, BP, height, and other medical problems, if any, will be attended, and her previous history, if she is suffering with any diabetes mellitus previously or any congenital heart disease or any surgical or medical problems, will be attended. She will have to undergo regular checkups, and she will be done with basic investigations, blood investigations like hemoglobin percentage, blood group and RH typing, and random blood sugar, HIV, serology like HIV, HbSAg, VDRL, and serum TSH, thyroid, and OGCT, urine routine. These tests will help to pick up any problems in the mother, which would be treated so that it does not affect the baby. In India, many women are suffering with anemia, which should be corrected. Major deaths are due to anemia, which in turn will lead to hemorrhage or maybe APH or PPH. If there is negative blood group, precautions will be taken and sugar test will be done. If there is any abnormalities in these tests, it will be attended. The baby will be healthy. And regarding the ultrasonography, minimum of 3 to 4 scans is mandatory. In the first trimester, NT scan is done, that is the nuchal translucency test, where this first trimester scanning is helpful for dating purpose. Maybe the dates are not correct, so we can take this as a dating scan, and also for the viability of the fetus, and also the USG markers. And nuchal translucency for any chromosomal abnormalities can be detected, like trisomies 21, etc. Any multiple pregnancies can be detected, ectopic pregnancy and also molar pregnancy. The second trimester or the anomaly scan, which is the most important scan to detect any major fetal anomalies like the brain defects, heart defects, the spinal deformities, and also the kidney, the stomach, the bladder, and the fetal limbs also will be looked upon. If there is any problem with any abnormalities with the growth, which can be terminated Legally, it is up to 24 weeks now. At the end of the 7th month, that is the growth scan will be done, which is an optional scan. The gynecologist will decide if there is any IUGR. If it is necessary, she will opt for this growth scan. And in the 9th month, the term scan is done. The importance of this 9th month scan is regarding the fetal weight, the liquor quantity, the placental location, and the fetal position. The Indian government has brought strict rules regarding sex determination. As there is an imbalance between the girls and the boys ratio, it is the responsibility of every Indian to follow this and prevent the ecological imbalance and the sex ratio, which is when there is an imbalance, which is most dangerous to the human kind. And coming to the immunization to the mother, 2 doses of injection tetanus toxoid should be taken. Now it is TD at an interval of 30 days, tetanus and diphtheria. And the medicines to be taken throughout the pregnancy is the folic acid in the first trimester and tablet FS and the calcium, which has to be continued throughout the pregnancy along with protein powder. And she has to, along with these medications, she has to take a nutritious and healthy and balanced diet, fruits and vegetables, etc. But most of the people tell that pregnancy is a physiological process, but it is important to see that the baby grows well. The mother is capable to bear the pregnancy and deliver a healthy child. Where delivery to be done, the Government of India has made it mandatory for institutional deliveries, 100%. That is no home deliveries. So that both normal and complicated deliveries are managed by experts. Usually pregnants go to their parents' home for delivery. Kindly keep in mind where to go for delivery. That is to identify the hospital beforehand, and how the means of transport of the pregnant lady to the hospital should be done priorly. Go to a good hospital where the mother and the baby both have facility with expert hands. Regarding normal delivery, we have to keep in mind both, that is the baby and the mother. The baby, how it can come down, the space the mother can provide, that is the pelvis. If there is any complication in both of them, normal delivery cannot occur. If there is no other complications, normal delivery will occur. If there is any complication with the baby or the mother, that is the fetal heartbeat or the liquor quantity or any cephalopelvic disproportion with the mother, LSCS would be done. And in my 25 years of experience, before women were capable of bearing the pain and also physically fit, doing all physical activity. Now the girls are educated, but pain bearing capacity is decreased and physically weak, and also she should be mentally prepared to bear the pain and enjoy the motherhood. And also it is like people are having only 1 or 2 children, not like before. So wrong notion in people is that they eat wrong type of foods like fried items and sweets, etc., instead of eating healthy and balanced diet. And they think that if they consume FS and calcium, some of the people think that the baby will grow more and the LSCS would be done, which is a wrong notion. The mother should definitely know about the alarming signs like giddiness, weakness, swelling of the body, legs, headache, blurring of vision. And they should know about the high risk pregnancy, like the age of the mother, that is more than 30 years or less than 18 years. More than having 3 to 4 children is also considered as high risk. And increased BP more than 140/90, and placenta any previa, that is low lying placenta, which leads to APH, and increased sugar levels, that is GDM, gestational diabetes mellitus. To know this, OGCT is done. All these can be found out if gone for regular antenatal checkups, and thereby safe motherhood, so that the mother is also healthy and bears a healthy child. Last but not the least is the family planning and the postnatal checkup. Family planning, it should cover both the temporary and the permanent method. The temporary methods like injection antara or intrauterine contraceptive devices, or the PPICD, that is the postpartum intrauterine contraceptive device, which is inserted immediately after the delivery. And the permanent methods like tubectomy, laparoscopic tubectomy, and for the male it is NSV, no scalpel vasectomy. And the postnatal checkups should be done minimum of 4 checkups within 45 days after delivery. The baby also should undergo the regular checkups for the growth and also the immunization schedule. And awareness to the mother regarding the breastfeeding and the benefits to the mother and the baby by the breastfeeding should be given to the mother. Government of India has brought many programs in this regard for the safe motherhood under NHM, that is National Health Mission, like Janani Suraksha Yojana JSY, where the importance is given for institutional deliveries, and Janani Shishu Suraksha Karyakrama JSSK, where there is free diet, free transport, free drugs, free diagnostics for the mother. And there are other programs like PMSMA, Pradhana Mantri Surakshit Matrutva Abhiyan, where the high risk pregnancies are identified on this every 9th day of the month, and they are given the service. And Matru Purna is one more program, and Nagu Magu is another program, and Lakshya. The 4 pillars of safe motherhood are family planning, antenatal care, clean and safe delivery, essential obstetric care. The motto of all these things are to reduce the maternal mortality rate and also the infant mortality rate. The maternal mortality rate in Karnataka at present is 92, with the target is to reduce to less than 70 by 2030, which can be definitely done when everybody join their hands. We will succeed definitely. I thank the RD College of Nursing for giving me an opportunity to talk regarding this Safe Motherhood program.